had surgery on Tuesday at 3 o'clock, so it's been like 2.5 days, 3 days.
3 days after surgery.
Yeah.
So I did your surgery 7 days after my surgery.
Yeah.
So what have you seen already that's gone?
Well, I notice when I'm in bed and I'm laying and I'm sleeping in bed, I don't feel that back pain that I was feeling before whenever I lay down.
You didn't have much in the way of leg pain, did you?
No, I didn't always have leg pain. Sometimes it would shoot down, but no, mine was more around the waist and the midsection. I'm already seeing that, that's already gone. So the only thing I feel now is kind of the tightness from the surgery and some of,
It's very collapsed.
Yeah.
So I made you probably like close to an inch taller, maybe 3/4 of an inch taller. And you end up paying for that with this weird sort of sensation. Now, I'm about a week ahead of you. And like we were talking earlier, I went back to my daughter right before surgery, and I asked her like, how often do you remember that like I wasn't able to do stuff? How often was I in pain? Because I was wavering, should I have disc replacement?
Right, yeah.
And she said, more than half the time, 60% of the time, I would refuse to do things. Like I stopped carrying my daughter. I stopped maybe, like I'll go to kiteboard and I'll pump up the kite, and then I have to like wait a few minutes. But you start accommodating, you start sort of like forgetting these little things. You sort of like, that's just normal. And then the next day is good and you say, whatever, then you forget about it.
Yeah.
What kind of things did you sort of find yourself splinting or not doing before this?
I'm a big boater, and I found that every time that I went out of my boat and did boating stuff, the next day my back was just destroyed, and I was down for like 3 days, or I was just, having to get some kind of treatment or therapy or something. And so I've been limiting some of the things that I enjoyed doing before. I believe that I've been limiting them. So I'm excited now to feel 100% and see if I can get back after some of those hobbies that I had.
I'm super excited for you.
Yeah.
And you're lucky. L5S1 is just like the easiest level to do. And mine was, I'll show you mine. Mine was 3, 4, 4, 5. And look, this is, so I did it last week I did it 7 days before yours. So yours is 3 days, I must be at 10 days.
Right.
Yeah. No back pain, nothing. No leg pain. See, for me, it was leg pain. And I'm not tough like you, I had this horrible pain, I couldn't operate. It was like about a month, 5 epidurals. And I was just like, I can't live like this. Some of my patients come to see me, especially moms. And I ask them, when was the last time you remember having no pain? And sometimes they start to cry.
Yeah.
They say, I don't remember. And I would say only women are like this. Only women can tolerate that much pain. Men are not tough like that. But now looking in retrospect, I can see that like I paralyzed a lot of my life for no reason. Especially now where you don't have to have a fusion, where you can maintain motion. I gotta tell you, it's a good time to be a spine surgeon.
It is, yeah, definitely.
You
It's a good time. I'm glad that I ran across you and found you on Google of all places, and came in here, and I knew as soon as I met you and talked to you for the first time, I knew that I wanted you to operate on me.
Thank you, Michael.
Thank you very much.
Hey, so I'll see you in 3 weeks.
Absolutely.
Aspirin, if you're sort of slow to get going.
Yeah.
Otherwise, don't take anything. Get back to normal life. And remember, you can't ruin this. So once it lets you, start moving, start bending. If it takes a week, if it takes 2, it shouldn't take that long.
I'm gonna start today working on a few stretches and things like that, with some towels and working on some.
If it hurts, pull back, try again tomorrow.
Yeah.
And if anything, you have my cell.
Absolutely.
I'll see you soon.
Thank you. Take care.